The COVID-19 novel coronavirus has been wreaking havoc worldwide. Taking all necessary precautions, we asked foreign residents of Tokyo how it has affected their lives.
My view is that Japan's response has been very positive and it's been well managed from the looks of it. It's been much better than what our families face in America or in the UK.
Well, I'm working from home, so that's a big change. My son's off school for the rest of the school year, so I think Japan was early in getting the schools closed, but then has been very slow since then.
And I think, listening to the governor's request that, people in Tokyo, stay home, but, you can still go to a restaurant until 7 o'clock. You can, or to a bar till 7 o'clock. You can still go to a restaurant until 8 o'clock at night, which basically says, does coronavirus only come out after dark? Which is not the case. And if I look at a lot of other countries, they've been locked down for a long time. I mean, in Australia, it's been weeks and there's not an end date to it. Here, I believe that the conversation around many people is we're not being told all the facts. We're not being told the number of cases because the number of testing is not high. And really, what are the facts? We don't really know them, I don't think.
Probably if they looked at the public transport a little bit more. There are no restrictions on getting on the train, and while I think it's less crowded as before, it's still, people are in a lot closer proximity than probably it should be.
Well, I think testing is not as, there isn't as much testing in Japan as I've seen in other countries, so I think that's a contributing factor to my concern. There's also a lot of news in the press about Japan's lack of a response, and so it has me concerned that we don't know the actual numbers of infected folks in Japan. I think this request, this lockdown, state of emergency, is more of a request than something that's being forced on folks. So when I look outside, there are folks everywhere. The trains are crowded. People aren't practicing social distancing. I mean, just looking at the store here, people are pretty huddled up and on top of one another. So I think that's something they should enforce as opposed to requesting citizens to do.
Yeah, I think the family have adapted well. They're all obviously in lockdown, staying at home, but actually everybody seems to be coping well, and I think respecting what's going on. I think they find it unusual, Japan. They kind of don't really understand, and to be honest, I don't really understand it a bit. We came out for a walk early this morning, and we just happened to come in here, but it does seem to be there's still lots of people around. Compared to other countries where there are all these things staying at home, it's not quite the same. It'll be interesting to see how it turns out.
Yeah, I think one issue is that now Tokyo or Japan has announced kind of a lockdown, but that means that people are going back to their home countries or home prefectures, and I think that's exactly what you'd want to prevent, because this is what spreads the virus. This is what happens in Spain. People from Madrid went back to their home country, and then this is how it spread in Spain. So this might be the risk in Japan too. But now last Friday, everyone left. So yeah.
I know people in Japan, or in Tokyo especially, it's very expensive, so people cannot stay at home in small apartments. So I do understand this, and they just want to go back where they might have a bigger apartments with their family. But still, I think it's very important right now to stay where you are.
Just days before these interviews, Tokyo announced a state of emergency. A group of about 40 experts worked together to formulate ways to stop the spread of the virus. The three main factors were to avoid the 3 C's of closed spaces, crowded places, and close contact settings. The Ministry of Health and Welfare announced a plan to reduce person-to-person interaction by 80% in order to contain the virus. By reducing secondary transmission to 1 or less, it is thought that the virus will not spread to uncontrollable levels. Many other efforts are being made in addition to the official government containment measures.
WAP? I have a handle. I have a soap. Wash, 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 wash.
This public service announcement on proper hand washing technique had already been in production. It's already been viewed over 6 million times worldwide.
Clean hand, clean hand. Pray for people and peace.
Wow, I haven't seen him in years, but I'm glad he's safe. Anyway, the point is that we really do have to take this seriously. And listening to all the interviews, everybody is very concerned about testing in Japan, and I am as well. There's a lot of fake news going around out there, and it's really hard to understand what to trust and what to believe, just because we don't know that much about this virus yet. But we are learning more every day. We also spoke to a few of my friends online. Nia from Vietnam works in sales between Japan and other countries. She told us about the differences between her country and Japan's response.
I was born in Ho Chi Minh City, right? So they are locked down already, approximately 2 weeks or 3 weeks. If you go outside, you go to the park, or you should wear a mask. If you take off your mask, you have to punish. Maybe they burst you and they show some police. They call you and they give you a mask. Wearing mask everywhere.
Okay.
And they give you some hand sanitizers. So nicely. They can give you for free everything.
Wow, that's impressive, actually.
Yeah.
Florian from Germany has been living in Japan for 8 years and works at a large Japanese company. He says he was dissatisfied with the way the story was first reported.
And I know this is a media interview, but with the media coverage in the early stages of the pandemic, where a lot of the stance was, hey, it's not that bad. We don't have many cases in Japan. And even if the situation changes afterwards, this first impression of, hey, this is not a big deal, is, I think, still in a lot of people's minds. And it takes a lot of power to change that to, hey, this is a lot more serious than we first thought.
April is the beginning of the fiscal year in Japan. He says that it's possible the corporate culture for new employees starting in the company will be quite different after the virus is contained.
Personally, for me, it was 2 months living together in the dormitories with all my colleagues, like around 100 people. So you really get to know each other, you get to know the company, and you kind of form a bond. And that kind of bond is not going to be there this year, I suppose, because everything's being done from home. So it's really going to be interesting to see how that's going to impact Japanese companies and how that's going to impact the employees. How about we continue this from next year onward and just change the culture in general?
Okay, great. Thank you so much for your time, man. So as you've seen, Japan is taking quite a different approach to containing this virus than other countries. But we don't know if it's working yet or not because it's still too early to tell. And since the time of these interviews, there has been much more testing being conducted and much more measures put in place. But we're still seeing the effects as an ongoing crisis. So the most important thing is don't risk it. Even if you're right or wrong about whether the virus is deadly or not, why risk it? All we have is our health, and the most important thing is to stay safe and to protect yourself and others by washing your hands, practicing social or physical distancing, and above all, just protecting yourself and your loved ones so that we can all get through this. We're in this together, and that's the most important thing. The AMDA International Medical Information Center provides Japan's foreign residents with advice. The hotline supports English, Korean, Filipino, Chinese, Thai, Portuguese, Spanish, and Vietnamese. Dr. Kobayashi Yoneyuki created this service and has been involved with providing healthcare for foreign residents for 30 years.
日本人の方でもどうしていいのかわからないのに、例えば PCR 検査を受けるにはどうしたらいいですかとか、そういうことがわからない。 熱が出た時に医療機関に行った方がいいのか、あるいは外で待った方がいいのか、そういうこともわからないのにですね、外国人の方はもっと迷ってらっしゃる。まずは医療機関を受診してくださいっていうことを言います。でそれから今症状があって、新型コロナを疑わざるを得ない、という方にはですね、どのようにしたら PCR 検査を受けることができるかというですね、流れのことをまずお話をします。でそして内容がですね、あまりにも医学的であると、これやはり電話を受けているスタッフというのは医療関係者ではありません、医師看護師ではありませんので、責任を持ってお答えができません。でその場合には私自身がその相談の内容を受けてアドバイスをするという形になってます。私が責任者としてやる以上はやはり他人に任せるお願いをするというわけにはいかないと、要するに逃げてはいけないということですね。